Well, it's time to work it out, and of course, you know it's unique, not different time. Shamala, good morning. How are you doing?
I'm good. How are you doing?
So far so good. I can't complain. At home, and I'm making sure I stay safe. I know this morning you're talking about the threshold for vaccines with persons with disabilities.
Yes, yes.
So I'm gonna leave you to it. Enjoy.
Thank you very much. Good morning, guys, and welcome to Unique Not Different with me, Shamla. And a topic that has not been discussed yet is vaccines and persons with disability. Actually, someone came forward and asked me so if I could have this topic because it's been a skepticism to persons who are spinal bifida, autism, Down syndrome, etc. So today I have Dr. Keegan Baga, and he is a physician too, right? And he's also the PRO for the TNT Medical Association. And the T and the and is not the A and B, it's the sign. And right? Good. So good morning, Dr. Baga. How are you?
Hi, morning. I'm doing good this morning.
Awesome. So let's get straight into it. So with regards to vaccines and young adults with disability, what, in your opinion and professionalism, in terms of at what point should somebody with a disability or parent consult a physician or a specialist in terms prior to getting vaccinated?
Sure. So definitely persons with disabilities are at a higher risk when they're affected by COVID-19. So that in itself is something that raises a threshold for wanting to get a person with disabilities vaccinated, right? In terms of the actual seeking your medical opinion or a specialist opinion, it really is based on the actual disability that the person's suffering with. So someone who might be suffering from, say, a loss of a limb due to some other condition, say diabetes or something like that, then that is a disability that might not really play a part in terms of affecting the side effects of the vaccine, right? But then you have to now get to the specifics of the exact vaccine that you're going to receive. So with the Sinopharm vaccine, there is a very, very rare side effect, perhaps even more rare than the clotting issue with the AstraZeneca. But that side effect, there was an association with epilepsy, but it's not really proven that it connected to patients with epilepsy or other neurological disorders.
Right.
But the condition that occurs, that rare side effect, is a neurological problem. So what happens is the vaccine has this rare effect where your body starts to affect the nerve fibers in your brain and in your body, and sort of gets a bit hypersensitive to that, and that causes a condition, a demyelinating condition. So it causes a neurological side effect, but this is something that it is also an extremely rare side effect of other vaccines that use inactivated viruses. So things like the flu vaccine has a similar possible rare side effect. Yeah. So, but the thing is, we give flu vaccines every year, and so many, and you still see a very small occurrence of that event. And you would expect something similar with Sinopharm. It would be extremely rare. But that is something very specific. And then in that sense, you'd want to see your neurologist if you have a disability related to a neurological problem. In terms of the AstraZeneca, the clotting factor, they have not found anything specifically associated. So like your pre-existing conditions, not really tied to that event occurring. So really at that point, if you have other disabilities, then you really just want to make sure that you're reasonably well going into the vaccine, because you need to have that recovery time.
All right. And in terms of, okay, so not everybody, in terms of have with a disability or even general, have access to a general physician or even a specialist. Is there any resources or avenue that they could call in prior to going to get the vaccine to say, here, what? This is me. This is what I have. This is what, this is the side, I guess, the symptoms. Should I get my vaccine?
Sure. So lots of people might not have their own private physician, but this is my opportunity to tout primary care. Everybody, based on where you live, belongs to one of us in a primary care health facility. So basically, even if you never came before, or if you came for a few visits, you always have the ability to come to a health center to get seen, because essentially you're one of our patients, even if you didn't know it. The only challenge is now, because of the COVID-19 vaccines, all of the access to the health centers everyone will have sort of different ways to go about it, because some, in terms of trying to avoid the crowd and controlling that spread. So some might prefer you call in. All should generally have separate zones. So if you have symptoms of a viral illness, we try to make sure you stay separate from those who don't. So again, as a way to prevent the spread. So it might be a little more of a challenge than your normal just walk up to your health center. But definitely, if you just look for your health center in the area and you give them a call, they will do their best to coordinate. And sometimes they could just give you the advice on the phone, and that helps alleviate all the issues.
Yeah, I'm going to drop a bombshell here, right?
Sure.
And you could comment. You can't say you can't come, but recently somebody close to me got tested positive for COVID, right? A PCR, no antigen test, and then a private PCR. It took 15 days for the private institution to call that individual, right? When they call that individual, they said the question was, can you read the, can you read what was given to you by WhatsApp? The second advice was, in terms of, like, after 13 days, if you get reading problems, call 811. They ask if you have any symptoms, right? So now my question is there any reporting or communication, I guess, or the thing going on between the private sector and the ministry?
Right. So in terms of the private sector to the ministry, by law from the public health ordinance, they have to report all positives they find. And as whether it's antigen, antibody, PCR, it doesn't matter what test they did.
Have timing, because it's only days after this, they're going to send it up to the ministry.
Yeah, I think if I remember correctly, the ordinance says immediate. You have to report it immediately, but I think their standard reporting for negatives was, I think, 5 days. They have a period of time. Yeah, so like within a week they have to report, but they're supposed to report positives immediately. But what I could say is that the challenge that might have happened in that specific case is very likely not just the communication from the private to the public, but also, so there might be a day or two gap there, and then there would also be a gap in moving down from, because when they report privately across to the ministry, it is to the CMO's desk, so at that level. And then that now has to distribute down to the correct CMOH in the correct area.
Right.
So that takes a little time. And then when that now received, because of the massive, overwhelming numbers that they've been having in the last those numbers just become physically difficult for everyone to keep up with the phone calls. So everywhere is trying to solve it differently, and everywhere trying to get that under control.
So to include, right, what advice would you give to the general public in terms of vaccination, as opposed to if it immunizes you, or if it's just a prevention to, I guess, escalation in terms of that, etc.
Right. So that's one of the things. So everybody thinks of vaccines as if it's all or nothing. You're prevented and that's it. You're protected forever. But no vaccines actually work that way. All vaccines have a percentage of efficacy, and the percentage of the efficacy of the vaccine plays a part in deciding what population level you need to achieve for herd immunity. And herd immunity is what you're trying to get to. So it's not really getting 100% efficacy for one person. It's about getting a reasonable efficacy. So 80% efficacy is really good.
Right.
Flu vaccines are usually 50 to 60%, and that still works really well because you give it to enough people. So if you have something at that range, that 80-ish%, and you give it out to enough people, then although you have a small chance that you could still get the infection, because everybody around you also has very small chances, the pockets of who can get it get smaller and smaller, and the pockets of who protected gets bigger and bigger, which means the virus sort of burns itself out in small pockets because it can't jump from person to person as easily anymore.
Be able to mutate and take over, etc. And
well, actually, mutations are different problem.
That, I guess, in a different topic.
Yeah. So the mutation is something where it changes over time, which will happen regardless. But just the herd immunity prevents the overall population from being able to get it, even though your efficacy is smaller. Now, the efficacy matters now because we haven't achieved herd immunity. Right. So if you have a vaccine that's 80% and there's a chance you get it, you wouldn't get as sick, but you still have this chance that you could get it. But if everybody around you also vaccinated, then they have too low of a chance to get it and too low of a chance to spread it, and your chance too low. So then you protect yourself by protecting everyone.
Awesome, Dr. Baran.
Yes.
Yeah, time, and I want to say thank you so much for coming. I think this was actually educational, eye-opener in terms of your responses. So thank you so much, and I really appreciate your time.
No problem. Thanks for having me.
No problem, guys. And I want to say thank you so much for tuning me to this week's segment of Unique Not Different. Until next week, as I always say, be safe, be good, do good. Bye, guys. Bye.